In this video, we are going to see the structures that are lying deep to the gluteus maximus muscle. So this is the gluteal region, and this muscle over here, these fibers, they belongs to the gluteus maximus muscle. We are going to cut and reflect the gluteus maximus along this line and this line. And for better understanding, we will be dividing and reflecting the gluteus medius muscle also. So this is the appearance of the gluteal region after reflecting the gluteus maximus and gluteus medius. So this was the cut edge of the gluteus maximus muscle, and this was the cut edge of gluteus medius muscle, which was lying over here, and this was the insertion point of gluteus medius. The structures that are lying deep to the gluteus maximus include muscles, nerves, vessels, and other ligamentous structures. So we have seen the muscles underlying the gluteus maximus in another video. I will explain it in a nutshell over here. This was the gluteus medius muscle, which was cut and removed. Deep to that we have the gluteus minimus. This is the muscle of piriformis, and here the obturator internus muscle with the superior and inferior gemellae. Deep to that we have the quadratus femoris muscle. Then here is the ischial tuberosity, and these are the origin of hamstring muscles. So all these muscles will be lying deep to the gluteus maximus. Other than this, we can divide the neurovascular structures of the gluteal region into generally two divisions. They are the structures passing through the greater sciatic foramen, which was located over this region, and the structures passing through the lesser sciatic foramen, which was located over here. These foraminae were produced because of they were sciatic notches, greater sciatic notch here and lesser sciatic notch below that. This was the ischial spine. These foraminae were these sciatic notches were converted to foraminae by the attachment of these two ligaments. First one is the sacrotuberous ligament, and next one is the sacrospinous ligament. These two ligaments will convert the greater sciatic notch and lesser sciatic notch into greater sciatic foramen and lesser sciatic foramen. Roughly saying, the greater sciatic foramen, which was lying over here above the ischial spine, will give rise to, or it's a passageway for structures leaving the pelvis and entering the gluteal region. The lesser sciatic foramen, which was located below the ischial spine, this was the ischial spine as I mentioned already, and this lesser sciatic foramen is a passageway for structures entering the perineum. If you look carefully, the structures passing through the greater sciatic foramen can again be divided into two, that are the structures passing above the upper border of piriformis at this region, and the structures emerging through the deep to the lower border of piriformis, that is this region. So the structures passing through the upper border, emerging through the upper border, will be superior gluteal nerve and vessels. The structures passing below the piriformis muscle will be inferior gluteal nerve and vessels, sciatic nerve, posterior cutaneous nerve of thigh, nerve to quadratus femoris, pudendal nerve, internal pudendal vessels, and nerve to obturator internus. The last three structures cross the dorsal aspect of ischial spine and adjoining part of sacrospinous ligament, that is over this area, with the internal pudendal artery between the nerve to obturator internus laterally and pudendal nerve medially, and they curve forward to enter into the perineum. So it will be leaving the pelvis through the greater sciatic foramen. It will be present in close relation with the dorsal surface of this ischial spine and sacrospinous ligament, and they will be entering into the lesser sciatic foramen to reach the perineum over here. The pudendal nerve and internal pudendal vessels then run in pudendal canal. So basically the structures passing through the lesser sciatic foramen, which was present below the greater spine of ischium, will be tendon of obturator internus, which is visible over here. Then the three neurovascular structures, that is nerve to obturator internus, internal pudendal vessels, and the pudendal nerve. You can remember the mnemonic PIN structures. Now let's look at each of the neurovascular structures in detail. First we will look at the arteries, then we will move on to the nerves of the region. So first one, the superior gluteal artery. Here it is. This is the superior gluteal artery. So it is emerging along the upper border of piriformis muscle. We have already seen that. And it is a branch of posterior division of internal iliac artery. It enters into the gluteal region through the greater sciatic foramen above the upper border of piriformis along with another nerve, that is the superior gluteal nerve. At this region, it divides into superficial and deep branches. This branch will be the superficial branch and this one will be the deep branch. The superficial branch, that is this branch, will pass between gluteus medius. This was the cuttedge of gluteus medius and this was the cuttedge of gluteus maximus. So this artery passes between the gluteus medius and maximus and supplies both of them. That is the superficial branch of superior gluteal artery. Next is the deep branch, that is this branch. This muscle that was lying underneath is the gluteus minimus. This was the gluteus medius. So the deep branch passes laterally between gluteus medius and minimus and subdivides into upper and lower branches. The upper branch takes part in the formation of spinous anastomosis around the anterior superiliac spine, and the lower branch takes part in the formation of trochanteric anastomosis along the greater trochanter of the humerus. Next artery over this region will be the inferior gluteal artery, which you can see over here. The inferior gluteal artery, it is a branch of anterior division of the internal iliac artery and enters into the gluteal region below the piriformis muscle along with the inferior gluteal nerve. So you can see the inferior gluteal nerve over this region. So these two structures emerge together, and this artery will be continuing along with this particular nerve, and that nerve is the posterior cutaneous nerve of the thigh region. And at this region, this artery will give rise to many branches, mainly muscular branches to adjacent muscles. We can see the muscular branches that is supplying the gluteus maximus, the piriformis. So it will supply muscular branches to adjacent muscles. Then it gives off anastomotic branches to cruciate and trochanteric anastomosis. We have seen the trochanteric anastomosis over here earlier. So it gives off a branch to trochanteric anastomosis as well as it gives off a branch to cruciate anastomosis also. Then another important artery is a branch of inferior gluteal artery, and that is the artery to the sciatic nerve, which we can visibly see from here. This is the artery to the sciatic nerve, and in Latin it is called as arteria nervi ischiadicae, and it accompanies the sciatic nerve and sinks into its substance to supply it. Actually, it is the remnant of axis artery of the lower limb. Next, we will look at the nerves of the gluteal region. First one, the superior gluteal nerve. This is the superior gluteal nerve and its branches. So it arises from the sacral plexus in the pelvis, and it is formed by the dorsal branches of the ventral rami of L4, L5 and S1 spinal segments. It enters the gluteal region through the greater sciatic foramen and above the piriformis, and it passes in company with the superior gluteal artery. Here it curves upward and forward over this direction, runs between the gluteus medius muscle and the deep minimus muscle, gluteus minimus muscle, and supplies both of them. It then comes out over here by passing between the anterior borders of gluteus maximus and gluteus minimus and supplies the lateral muscle, that is the tensor fasciae latae, from its deep surface. It also provides an articular tweak to the hip joint. Next nerve, that is the inferior gluteal nerve. Here is it. This is the inferior gluteal nerve. So it arises from the sacral plexus in the pelvis, and it is formed by the dorsal branches of ventral rami of L5, S1 and S2 spinal segments. It enters the gluteal region over here through the greater sciatic notch in company with the inferior gluteal artery. This is the inferior gluteal artery. And another nerve, that is the posterior cutaneous nerve of the thigh. These three structures come out together through the inferior border of piriformis. Here, at this point, this inferior gluteal nerve curves upward to supply the gluteus maximus from its deeper aspect. This was the cut edge of the gluteus maximus. So, in between the gluteus medius and maximus, that is the plane of inferior gluteal nerve. Next prominent branch, and apparently the largest nerve trunk of this region, that is the sciatic nerve, which is lying over here. It enters into the gluteal region through the greater sciatic foramen below the piriformis. It is clearly visible. And it is somewhat the lateralmost structure emerging through the greater sciatic foramen below the piriformis, as you can see from the diagram. It runs downwards and slightly laterally under cover of gluteus maximus, midway between the greater trochanter, that is over here, and the ischial tuberosity. This is the ischial tuberosity. So this was the line connecting greater trochanter and ischial tuberosity, and this nerve is passing over the midpoint, midway between these 2 points, ischial tuberosity and greater trochanter. And then it enters into the back of the thigh, and it seems to emerge from the lower border of gluteus maximus. All the muscles on the back of the thigh, that is hamstring muscles, and muscles of all the compartments of leg and muscles of dorsum and sole of foot are supplied by sciatic nerve. Next nerve over this region is the posterior cutaneous nerve of the thigh. This is that nerve. It arises from the sacral plexus in the pelvis from dorsal divisions of the ventral rami of S1, S2, S3 of sacral plexus and enters the gluteal region through the greater sciatic foramen below the piriformis and lies medial to the sciatic nerve. This was the sciatic nerve, and this nerve is lying medial to it. It runs downward and medially superficial to the sciatic nerve. We can see the course very clearly over here. It is continuous on the back of the thigh deep to the fascia lata. It gives off the following branches: a peroneal branch to supply the skin of posterior 2/3 of scrotum and labium majus, and the gluteal branches to supply the skin of the postero-inferior quadrant of the gluteal region. So the unique feature of this posterior cutaneous nerve of thigh is it is the most part of this nerve lies deep to deep fascia, even though it is a cutaneous nerve. Next nerve is the nerve to quadratus femoris. It arises from the ventral divisions of ventral rami of L4, L5, S1 of sacral plexus. It enters the thigh through the greater sciatic foramen, same greater sciatic foramen, below the piriformis and runs downward, very important, deep to the sciatic nerve. It passes deep to the sciatic nerve. It runs downwards also again deep to the tendon of obturator internus and two gemelli, that is gemelli superior and inferior, and supplies the inferior gemellus, that is the muscle over this region, and the quadratus femoris, that is the muscle over here. It also gives an articular twig to the hip joint. So it is very clear that if you want to see this nerve to quadratus femoris, we have to remove a part of the sciatic nerve as well as a part of the obturator internus with the two gemellae. That is the view over here. Sciatic nerve has been cut off and obturator internus and inferior gemellae has been removed to see this particular nerve, and that nerve is the quadratus femoris. It lies deep to all of them. Next important nerve over here is the pudendal nerve. So this is the pudendal nerve. So it arises from the ventral divisions of the ventral rami of S2, S3, S4 segments of sacral plexus. It enters into the gluteal region just to leave it. It enters the gluteal region through the greater sciatic foramen below the piriformis. This was the lower border of piriformis. This was the point of emergence of the pudendal nerve. It crosses the dorsal aspect of the apex of this particular ligament, that is the sacrospinous ligament, medial to the internal pudendal vessels, and leaves the gluteal region by passing through the lesser sciatic foramen, which was located over here. This was the lesser sciatic foramen. This nerve is passing through it, and then it enters into the pudendal canal. Here you can see the canal structure over here, that is the pudendal canal, and at this region it will give off at this perineal, and after passing through the lesser sciatic foramen, it gives off the inferior rectal nerve, perineal nerve, and dorsal nerve of the penis. The next nerve is the nerve to obturator internus, which we can see over here, which is lying just lateral to the pudendal nerve. The nerve to obturator internus arises from the ventral divisions of the ventral rami of L5, S1 and S2 of sacral plexus. It enters into the gluteal region through the greater sciatic foramen below the piriformis muscle. It crosses the dorsal aspect of ischial spine, which you can see very well here. That is the ischial spine region, deep to that. And it crosses the dorsal aspect of the spine lateral to the internal pudendal vessels. That is not shown in this diagram. Actually, the internal pudendal vessels will be lying in between the pudendal nerve and the nerve to obturator internus. And after passing lateral to the internal pudendal vessels, it then passes forward through the lesser sciatic foramen. This was the area deep to the fascia covering the obturator internus. It supplies obturator internus and gemellus superior. Lastly, we have the perforating cutaneous nerve. This was the sacrotuberous ligament. You can see a nerve is piercing the sacrotuberous ligament and is winding around the lower border of this large muscle, that is the gluteus maximus. That is the perforating cutaneous nerve here. So this nerve arises from the sacral plexus, that is S2 and S3 spinal segments. It pierces the sacrotuberous ligament, which is over here, and then it winds around the lower border of the gluteus maximus to supply the skin of the posterior-inferior quadrant of the gluteal region. So the structure we have left out in this region will be the internal pudendal vessels. That was one of the pin structures, and that will be present in between the pudendal nerve and the nerve to obturator internus. That also emerges through the greater sciatic foramen, and that will be entering into the lesser sciatic foramen after winding around the posterior aspect of the ischial spine. That was in general about the structures under cover of gluteus maximus.